Doesn't look like it, but we are actually supposed to be full today. And we've actually had more people register than there are seats in the room. And you'll see these little open seat signs. And at some point when you get crowded, you know, if you've got an open seat at your room, at your table, please put that out so folks will know that they can sit there. And one more thing is, take a second right now and say hello to everybody at your table. You're in Atlanta. Say hello, y'all. Okay, that's it. Enough camaraderie. Everybody said hello. Cool. I want to thank our partners in the program today. The Center for Strategic and International Studies, hereafter to be known as CSIS, because nobody can say Center for Strategic International Studies, CARE USA, and the staff and volunteers of the World Affairs Council, a lot of whom you saw outside and a number of whom are here in the room. If you're part of the World Affairs staff or volunteer, raise your hand. Yay! They've done a great job, I think. I also want to welcome the people who are watching this conference online, who are around the country. Hello to you all, wake up. And particularly the World Affairs Council of Western Michigan. Hello, Dixie, Erica, and Ashley. A question, how many of you have been to one of our health conferences in the past? Raise your hand, please. So that's cool. That's what, about 40% of the people here. That's great. Welcome back. How many of you are members of the World Affairs Council of Atlanta? If you're not, by the end of the day, you should be. Please join. And we can solve that. The people outside who gave you your name tag can solve that for you. I want to thank the sponsors, without whom this would not have been possible. UPS, the Coca-Cola Company, the Robinson College of Business at Georgia State University, the CDC Foundation, Hartfield-Jackson International Airport, Hawaii Pharma, and all the other companies that are listed there on the slide that y'all can see. There's also an anonymous donor who's not in the room, but who actually paid for lunch today. And I want to thank the anonymous donor, without whom we would all go hungry. So thank you, donor. Woo! So now down to business. Secretary Kerry's in Geneva right now, trying to, in an emergency meeting, trying to put back together what was not even a ceasefire in Syria to begin with, but was, in fact, it was a, Simon, what was the official word that we called it? It was like a, what? Cessation of hostilities, which worked for 2 weeks? A little bit longer than that, says Principal Deputy Assistant Secretary Henshaw. I mean, this is a health conference, but a health conference that clearly is a health crisis caused by politics. The last pediatrician in Aleppo was killed last week. I mean, that's a health crisis that is not caused by disease, but is caused by politics. And that's what we're going to be talking about today. Every generation has faced issues of people who, because of conflict or political instability, are forced to leave their homes, their countries. Today, 60 million refugees around the world are wandering in the desert, as the children of Israel did in the book of Exodus. That's the largest number since the end of the Second World War. While refugees from Syria rightly grab the headlines, North Africans are fleeing to Italy and Spain. Somali refugees have found refuge in Kenya and Uganda. Burmese and Burundians and Yemenis flee conflict in their countries. Central Americans have come to the United States fleeing violence in Honduras and El Salvador and Guatemala. Apart from the political issues of where 60 million people can find refuge, how to resolve the crises that generate the refugees, and where and how to settle them. We've got to deal with the health issues and the special health issues of these refugees who obviously have left home because they had to, not because they were healthy and ready to travel, and who are suffering all kinds of issues as a result of having fled and having gone through these really difficult, traumatic experiences. Refugees move for a reason. They don't move because they want to. They move to save their lives in untenable situations where they do not enjoy the most basic of protections from war, political strife, discrimination. We've seen the photos of refugees risking their lives in precariously overloaded boats and armies of refugees tramping across Europe. The photo of 3-year-old Alan Kurdi, who washed ashore on a Turkish beach, takes that number of 60 million and connects us immediately. That we can understand. 60 million, we cannot. It takes one person to make that 60 million real. So that's what we're going to talk about today. At times it's not a pleasant topic, but it is one where we had a dinner last night with the speakers, and I learned a huge amount. And one of the most important things I learned is that my image of refugees is one that is so out of date. It is the image of refugees in the 1960s in camps in a neighboring country. And that's just out of date, and we've all have to adapt and update our mental image of that. J. Stephen Morrison is the Senior Vice President for Global Health Policy at CSIS and our partner in this endeavor over the past 5 years. And Steve, I'm going to invite you up here. Thank you.
Thank you. Good morning, everyone. I have the honor of introducing Paul Spiegel, who's come from Geneva, UNHCR, to be with us today, and I'll say a few words about Paul in a moment. I want to first thank the World Affairs Council, Charles, Henna, Christina Rennie, Fernanda Lucina, Claire Morton, and all of the staff for this fine, really remarkably successful job at putting this program together this year. This is our 5th year. We started this as an experiment 5 years ago as a partnership between CARE, World Affairs Council, and ourselves. Each year we've brought in Tom Frieden and others from CDC as partners. Each year we've brought in subject experts from Emory, from Morehouse, from Georgia Tech, and we've brought in Senator Isaacson multiple times as a key personality caring very deeply about these issues. We've done programs all over the country, and I think this one has proven to be the most durable and successful of these. And so I'm very grateful to the World Affairs Council and to CARE and the new leadership, Michelle Nunn. And today we have Christine Galavati with us. Thank you, Christine, for joining us. And we have in the program, I think, done far better than in past years in bringing in a very high quality and very diverse group of subject experts from outside of Atlanta to fill out the program, coming from, as you'll see, from many different places and many different walks in terms of where they are approaching this crisis of refugees and IDPs in their own professional existence, whether it's in an international organization, a USG agency, a non-governmental group, a university-based analytic effort, and on and on. We've asked Paul to come and kick this off by using his expertise and perspective from where he operates in Geneva at UNHCR to lay out the big picture for us, because it's a complicated, fast-moving, and very difficult picture that we face today globally in terms of the challenges posed by refugees and internally displaced persons. This is a big moment of the world turning its attention in a very significant way over multiple steps unfolding. The World Humanitarian Summit is 2 weeks out in Istanbul, but there are multiple other things that have been unfolding over the course of the winter and the end of last year, and that will continue to unfold going forward. This is an expression of just how important geopolitically all of these issues have become, and you're going to hear from Paul about that, and then we'll move into several panels that unpack different dimensions of the issues. We are, as you'll see, we're highly reliant, the system, to the degree there is a system that UNHCR stands at the center of, in providing leadership and coordination and data and perspectives. We are very reliant on that leadership. It has new leadership in Filippo Grandi, Kelly Clements, who went from the Department of State, same bureau that Simon is from at the State Department that administers these programs. It's also highly reliant on U.S. support, leadership, finances. And I think it's great to have Paul here speaking to an American audience to remind Americans about how important it is for that U.S. leadership input in supporting its efforts to bring about a strengthened and improved system, which is what is front and center today. We'll hear more from Paul about some of the new tools that are being developed. We heard about some of that last night in terms of greater integration of options from the private sector, more innovative approaches, taking a longer-term approach, bringing in new powers that have influence and wealth who have been less engaged, and trying to look at what it's going to take to remake the system in a better way in the next coming years in the midst of multiple breaking and urgent situations. As Charles pointed out, many of these crises that are driving this phenomenon are ones that are driven by unresolved political crises that require high-level diplomatic interventions in order to resolve those. And as we've seen with Secretary Kerry and the efforts of the Geneva process around Syria. But the urgency of all of these programs that we'll be hearing about from Paul is one that we have to walk and chew gum at the same time. We have to operate in a world of real response to the urgent requirements and be thinking through how to better manage, organize, finance, and move forward the multiple parts to this humanitarian system, to expand coverage, to expand access, to get around the dramatic security threats that we face today, particularly coming out of armed and violent radical Islamist organizations, while also at the same time pushing really hard to elevate the priority of getting negotiated resolutions to these really tough problems. We've got a lot of new wars, we've got a lot of old wars that are driving all of these. So please join me in welcoming Paul. Paul is coming as the Deputy Director of the Program Support Division at UNHCR. That sounds somewhat bland and technocratic, but it's not. It's really the heart and soul of what UNHCR does in terms of public health, which is of special importance to us, in terms of livelihoods, energy programs, environmental programs, cash initiatives. All of this falls within his orbit. I also want to emphasize that as of July 1st, Paul will be joining the Johns Hopkins program, the Center on Refugees and Disaster Response at the Bloomberg School in Baltimore, and we're thrilled that Paul will be coming our way and rejoining the community in the Washington-Baltimore area, and we're hoping we'll see much more of Paul programmatically here as well as in Washington, Baltimore. So, Paul, thank you so much for coming to be with us today. The floor is yours.
I'm not ناوي بقرن شخص بلادي بارما شعر جيبون يعني نوسي هنا أم نوسي كان رند نوسي مانا أم نوسي كان جيزوري خوا جيجك شعر جيبناجي نوسي زوري خوا بيسري كرنا خميزي مريدو إيريدو بقرن مستحيل ما بقرن.
Today, 60 million refugees, asylum seekers, and internally displaced. Almost double the number 10 years ago. It's a rising tide spilling across borders.
هي ميتين دول عربية هو موت واحد هو قررنا هي موت أو المصابة من مصر.
15 conflicts, either new or burning again in the last 5 years. 42,500 people displaced each day, every day. Mega conflicts in Syria and Iraq have displaced 15 million people. Conflict pushing refugees and migrants into flight.
كل واحد بياخذ القرار بيكون يائس يعني من كل شيء. من كل شيء يائس. ما بعرف. حسيت حالنا خسرنا كل شيء يعني ما بقى يعني يا بنعيش سوا يا بنموت سوا.
Protracted exile, lives of extreme poverty, hopelessness driving thousands to risk their lives.
Naona amani kule hakuna juu watu wako wanakimbia, wanafunzi hatusomi tena, wanafunzi kwa wenyewe tunakaa nyumbani.
Mimi ruhusa yana sawa. Mungu kahamugal kale kwa tamu usko ushwale tahadi. Shuko yala hena kuka.
Mediterranean deaths in 2015, almost 3,000 and climbing. The wave is now global.
أهم شيء إني أوصل للي بدي إياه إنه البلد اللي الله بيسر لي إياه إن شاء الله أضمانه يا رب ونبدأ إن شاء الله حياة جديدة بإذن الله.
The desperate drive to find safety has overwhelmed some countries, stretched the resources of others, but also awakened generosity. Across the globe, countries that have taken in so many need much more help now. Another pressing need to protect people against populist racism and xenophobia. But most of all, these people need more hope. UNHCR was born of the search for new values in the wake of a global war, its principles enshrined in the 1951 Convention. Those pillars must now be safeguarded and strengthened.
Excuse me. Thank you, and good morning, everyone. And thanks to the organizers for this, and thank you, Stephen, for the introduction. I thought I wanted to play that video because I felt it could show the situations in a much more visual and broader way than I could by just discussing them. What's clear is that the system right now, the humanitarian system, is overwhelmed. There's no question. There are so many crises going on, and I don't think we currently have the capacity, nor do we even have the tools in place to deal with the multitude as well as the magnitude of the situation. What I'm planning to present to you today is a little bit more the future of the way we may be able to go, that I hope we'll be able to go. And this is not, of course, just my ideas, but where the community has been working over the years. So can we put up the slides, please? While we're waiting, I'll start. So one of the big issues, and I think Charles said it, is that we still think about refugees in camps in sub-Saharan Africa, of which there still are many. But, and unfortunately, many of our tools and how we respond actually have been developed for those issues. But it has changed. The situation has changed. The epidemiology has changed. Is it possible just to get my slides up, please? The situation has changed, and what's happened now is you have over 50% are living in urban areas, and the majority, the large majority, over 60% now, are living in outside of camps. And again, how do we respond to those situations? And I'll try to explain some of those issues. And the second big issue is protractedness. The Syrian situation is actually considered by, depending on the definition you use, but over 5 years is now a protracted situation, which is obviously very emergent. It's acute at the same time. And what we're learning, and I was just talking to someone at the beginning, just at the beginning of the conference, is one always hopes that refugees, IDPs, that the situation will be short. But in fact, it often ends up being very long. But the donors give, and understandably at times, they give for 1 year, and we're under a lot of pressure to put in systems that will be temporary. Yet if we start thinking and putting in longer-term systems, likely it will be financially viable. Glad I brought my notes here, because I can show you the pictures. The next issue is alternatives to camps. So when we're looking now outside of camps, it's taken UNHCR way too long, and other organizations. I think about 6 years ago we developed a very clear policy of how to deal with urban refugees. We're now working, and we've flipped it around. And so when we have emergencies, what we try to do is we ask our representatives in the field and the governments, please don't put up camps. If possible, put refugees in, or internally displaced persons amongst the villages, if possible, and try to integrate. But there are big issues. There are, first and foremost for governments, security issues. And in fact, if you look, or if you consider that our main ministry that we work with is the Ministry of Interior. It's not the Ministry of Health or Integration, for obvious reasons, when you see what's happening in areas like in Boko Haram. The areas in Nigeria and surrounding, security is a huge issue. But in order for us to be able to have alternatives to camp, if we were going to keep refugees or internally displaced persons outside of camps, we need to be able to actually, they need livelihoods, they need the capacity to actually make some money. Otherwise, whether in camps or out of camps, they'll become dependent, and sustainability is a key issue. And one of the big failures of the humanitarian world over the years is a culture of fostering dependency. And it's something that we are trying, but it's not easy, but we are trying to get away from. So if we do have put refugees out of camps, for example, what next? What are the steps to ensure that refugees will be able to make money, and that we'll be able to actually have that money and spend that money? So the next issue is UNHCR has also worked with many. UNHCR is an organization that does not survive without working with governments, with non-governmental organizations, and the other UN agencies. So we have, and it was a very pretty slide picture of our livelihood strategy, 2014 to 2018. What's happened in the past is livelihoods in refugee settings was primarily more psychosocial. It was basket weaving. It was, I can't tell you how many refugees can basket weave and can cut hair, but they've never been able to make any money off of that. So there's been a complete change, and we're really trying to look at socioeconomic aspects. Most importantly, what are the socioeconomic needs of the host population there? So trying to do a mapping. And this is not just UNHCR, because we don't have many of these skills. What are the skills of the refugees, and how can we try to meld them together to improve? And so what we have done is we developed streams of initiatives. You will hear soon, but the Syrians have many talents. One of them are artisanal, so they artisans, and they can do some incredible work. We have been working with various private sectors and in various countries, but particularly in Lebanon and in Jordan, and we have been working with the traditional Syrian refugees who are experts in their area, but then working with modern designers in the Middle East. And it has taken a long time to be able to agree, and then with multinationals so that they can be changed. The designs can be, let's say, modified for more of a broader mass market and then actually sold abroad. It's not been easy, and as you can imagine, in many of these countries with high unemployment rates, for their local populations, to be able to convince them that actually refugees can add to the local economy can be difficult, and you can see it here when you see how immigrants are portrayed, and illegal immigrants, for instance, are portrayed in the United States, of them taking American jobs. It's the same thing, even though that may not be true, and likely is not true, it's the same thing in many of these countries. So we have had to deal with a very difficult regulatory environment. And one of the areas that has been quite exciting is we've worked with the World Bank. And the World Bank in the past has primarily been development, as you know, but with the huge numbers of refugees and IDPs and those affected by conflict, the bank has come to understand that their development goals will not succeed in these countries if we don't address these issues. And we have, as you know, Jim Kim, who was an immigrant himself, who really understands and works on these issues. So what we've been doing, we've done a bunch of studies, and they're out now. You can check on either the bank's or HCR's site. But one of them that I think is interesting is to try to look at how refugees economically affect both the positive and the negative, how they actually affect the local economy. Most of the time, and if the previous studies and the governments that we're hosting were always saying they are affecting our economy negatively, and they give various examples. But we've done some studies in Turkey, and for example, in 2014, I'll read it here, Syrians accounted for 26% of the new foreign businesses registered. And as is expected, because many are unregulated, the Syrians did take some of the jobs of the unskilled workforce, but because of the demand, increasing demand in those areas, many of the unskilled workforce of the Turks were able to actually join the skilled workforce, and so there was actually a movement up as opposed to a replacement. And poverty rates have fallen faster in the regions in Turkey hosting the refugees than in the surrounding areas. Now, there's no question this will not be perfect, and that there's going to be, at times, there may be issues in crime and housing as you have an increase of a population in different cultures. But it's one of the studies, and we'll be having more, that are trying to show that if we actually work with refugees and the host countries, that it could be a win-win situation. And I think that has to be our goal. We can't expect host governments to accept refugees where there's high unemployment rate unless we can make sure that they will also benefit. But we think there are ways to do that. Now, the next area is actually if refugees are making money, and this to me is one of the most exciting, is our cash-based interventions or cash transfers. Most of the humanitarian response has been in kind, providing material goods, whether it be food, baskets, etc., plastic sheeting, to persons of concern, to refugees and IDPs. What's changing now significantly is cash transfers. And I must say, and I didn't say before, the other big change is that we are dealing with refugees and IDPs in middle-income countries. It started in the Balkans, Kosovo, and now, of course, Iraq and Syria. And that changes because their demands of the people, the level that they're used to, is quite different. And there are functioning banking systems. And so in Lebanon, Jordan, Turkey, Egypt, there are ATM cards that are provided to refugees. And for the most vulnerable, they get a certain amount of money, and it's the refugees themselves that get to choose. Besides the obvious dignity that provides, it also allows the local economy to prosper because we're buying locally as opposed to bringing in. But it is complex, and we're working a lot with the private sector, and to name a few, UPS, Western Union, MasterCard, and as well as all the local banks. But it is a challenge to the humanitarian community, and we'll see how this plays out. It's called multi-purpose cash. As opposed to planning by sector and then measuring by sector, we're giving a certain amount of money. The person, he or her, him or herself actually choose, which is wonderful, of course, and it gets away from some of the paternalistic ways of working. But it is complex, and particularly with donors, how do you report back? And we have to be careful about markets and the market issues, because obviously if you provide a lot of cash into an area, that could have negative implications. And then looking at health, which I will briefly speak about now, cash for health and for education will be more of a challenge, because you can give cash to provide, and they can buy, refugees or IDPs can buy food if it's available. But if you give cash for health and there are no functioning health systems, there are no healthcare workers, there are no teachers, then you can't buy anything. And so how to work out in the future, how to give cash and how to deal with the medical aspects will be complex. On top of that, and the next area, before I move into that, I also want to talk about other areas that we haven't sufficiently focused on in terms of finances. Another one is remittances. Remittances, as you know, is huge, and there's more money going back to these areas and refugees receiving remittances, but amazingly also, perhaps not amazingly, refugees making money themselves and then sending it back to Somalia and other areas. So remittances is a whole area that we need to look at, because one of the problems right now is we are dealing with the traditional Western-dominated humanitarian system. You're now dealing in the Middle East with a whole other system, primarily Islamic groups that are working through different channels, and you're dealing with remittances and a lot of other areas, and there isn't sufficient cohesiveness, and that's causing actually the aid provided to be less effective. So when we deal with, now that we have, they're out of refugees or IDPs, they're out of camps, they actually have a way to make money. In some ways, the goal may be eventually, that we're considering, is to have virtual bank accounts for refugees, because that's another big area right now, is refugees, IDPs often have no identification. IDPs, internally displaced persons who are nationals, maybe within their own country, could find a way to actually open a bank or go to the equivalent of a Western Union to get money, but this may not be possible for refugees. So how do we work on setting up virtual bank accounts? This may be a reality. But then, as we move into health, one of the big areas that we're working on is integration into services, obviously all services, health and education. In the past, again, we mostly set up parallel services, which are more expensive. They don't necessarily help the nationals, except those that can go and actually access these services, but all of the surrounding services for the nationals are not being helped, except at times the district or regional hospital. So we're working in terms of how to try to improve integration, and it's quite a challenge. It's not as easy as one would think, because number one, the health systems are often not strong in some of these countries. They're often overwhelmed, and then you have the international community come in, and you're changing the fee structures. You're often taking all of the strong healthcare workers. So moving towards integration is a very, very important aspect, but it can be complex. What we have been working on, the other big area, and I'll stop shortly, will be looking at context-specific and trying to explain and make sure, whether it be health, and I'll give an example, that there's no one-size-fits-all. It seems very obvious, but the system itself, whether it be clusters or refugee coordination, usually has one system. And as we look more and more in the world to working with governments who are quite strong, and working with local NGOs, the international system will have a hard time fitting in. One example was the Syrian, Afghan, you name it, all the refugees coming into Europe. They were moving, constantly moving, and in fact, none of them wanted an ID. So many of us were in Greece and Lesbos, and we wanted to vaccinate, because one of the key issues is to obviously vaccinate children. They didn't want to be vaccinated because they never knew when the borders were going to close, so they just wanted to move. Secondly, they didn't want any identification, because if they had identification that showed that they were in Greece, they would be stopped there, and they may have to stay in Greece. So we actually came out with WHO and UNICEF an agreement to say, for this particular purpose, because of the constant movement, we will vaccinate, but vaccinate them when they actually arrive where they're supposed to be, where they wish to be, as opposed to on the move, because it was being refused. Another big area that we talk more and more about that's not particularly new is, of course, non-communicable diseases and mental health, and we'll be discussing that today. And the last I'm going to, and then I have one more short video. At least those are working well, I think. The last thing I want to talk about is actually something that could be very exciting, but again, I think will take some years. We are working more and more in trying to see if refugees can be integrated into social safety nets of a country. There needs to be a reason for the country to allow that to happen, of course. But if refugees are able to work and actually and one of the reasons besides the high unemployments is that governments are concerned that if refugees are allowed to work, they may stay there for a long period of time. And of course, the goal for all of us is that there's peace in the country where they've come from and they will return. But there are concerns about keeping them there, and there are concerns about being a pull factor. So all of these need to be dealt with. But in some countries, in West Africa, and interestingly in Iran, a place that I visited a lot in the last 10 years, we have worked on getting refugees health insurance. And they've actually, the Iranian government, it took a long time. We started with private insurance, and now they're actually integrated into the national health insurance like a normal a national. Refugees, it's mandatory because there needs to be a sufficient pooling of funds. Refugees are allowed to work in many cases in Iran. And we had approximately, it's changing now, we had about 850,000 Afghan refugees with national health insurance in Iran. We're working this in 4 or 5 other countries. And UNHCR pays for those that are most vulnerable. We'll pay the fees, the premiums for those that cannot. This, again, is just another way that we hope that we can try to both benefit the governments, but also benefit the refugees. And one goal we could have in the future, and this is a bit like what happens in Ethiopia and other areas where the World Food Program does some microfinance for drought. Is there a way in the future that we could have a fund and we pay ahead of time so that when a refugee comes over a border and a national system is functioning, they could automatically go into the system could be improved, and there would be money there to pay. So there's a lot to think about and a lot of changes in the thinking. With that, I want to show one last 45-second video that brings home at least the personal, the people, the individual, because it is easy to think about numbers, as we all know. And so I'd like to show this short 45-second video, if you can play that, please.
Ότι έχω παρέα μες στο σπίτι, ότι μιλάω, ότι γελάμε, αν και δεν καταλαβαίνουμε τίποτα ο ένας τον άλλον τι λέει.
Thank you very much. Good job.